All right. Well, let's get started. Looks like we have quite a few people that have already entered the room, watching us from afar, and some maybe from near. Welcome. I'm Jessica Goolish from Spruce Health, and I welcome everybody to the webinar for streamlining your operations to improve efficiency, and let's focus on patient care. So we have a lot of great information and great people on this call today. And we're going to introduce everybody in a second, but I just want to go over some housekeeping. We are in a large webinar with lots of people, and we know we're all busy, and you guys are all busy. We thank you for all your time you can spend with us today. But if you can't spend the whole time with us today, we are recording this. And so we're going to send it to everybody that attended and didn't get to attend. You'll get a recording. So feel free if you have to drop off and finish watching it later. And you can even watch us in 2x speed. So please know that we are recording this because we always get that question. And then at the bottom of your screen, you hover over the screen right now. You're going to see that there's a Q&A, question and answers. That's where you can ask your questions. We are going to take questions that are relevant throughout, but generally we're going to do most of the questions at the end. And we hope to get to all of them. So please put those in there. We love that. And we have disabled the chat. So the questions are your way to go. And then we're also going to share our contact information. So you can always ask your questions later if they come up. So very, very happy to help everybody that's here today. And thanks again for joining. Oops. All right, quick agenda. We're going to do some introductions. And then we're going to meet our docs that we have on the call. We're so lucky to have you both. Thank you. And then we're going to do the Q&A. And the Meet the Doctors is really going to be a time for them to share how they use both Edge, remote talent company, and how they use Spruce. And it's going to be a little kind of, what do they say, fireside chat, and just asking questions and helping you as our attendees of this webinar learn about what it is to adopt both of these platforms or similar platforms. All right. Well, first, you already saw my face and talking already too much, but I'm Jessica with Spruce Health. And I think we have a lot of Sprucers and Spruce users on this call today. But for those of you that are not familiar, Spruce is a communications platform for healthcare. And so everything we do has your practice in mind. HIPAA compliance, security, team collaboration. We do everything from phones, texting, telemedicine, and faxing, and collaborating around all those wonderful communication channels. We've been around about 10 years. I've been at Spruce for 8 years leading webinars like this, and I love it. I am head of sales now, and so help you guys when you come in and want to learn more. I'm available. You can view our website at sprucehealth.com and sales@sprucehealth.com. So that's me, and I will now pass it off to our partners that are here. We are two separate companies, but we partnered up with Edge because we have some wonderful customers that love them. And so we wanted to learn more about how they use Spruce and how their product works. So I'll turn it over to you, Ahmed. Thanks for joining.
Yeah, thank you so much, Jessica, for the opportunity to collaborate today. Hello, everyone. Good afternoon. My name is Ahmed Donawala, as Jessica mentioned. I lead the sales function here at Edge, and super thrilled to be here today, not only with Spruce, of course, but with Dr. Kiok and Dr. Tsui. Thank you again for joining today as our guest speakers. In regards to Edge, we have identified two major pain points. And I know there's a ton of pain points, but really two major pain points that practices are dealing with going into 2025 and beyond. And that is finding strong candidates when you're looking to hire support staff, and then being able to actually keep those employees long term. And today, Edge and partnering with hundreds of medical practices, we've been able to connect them to really strong employees, ultimately who are aiming to bring value through a HIPAA certified and secure process, with the mission being that we are making the hiring process easier than what it is today in your local markets, but also adding to your practice culture, because that is a major, major piece of patient engagement today. Next, I am going to introduce our lovely doctors who have joined us today. Number one, we are here today to discuss practices and how they're streamlining operations to improve efficiency and continue strengthening that patient care process. Number one, I'd like to introduce our first guest speaker. We are today joined by Dr. Matthew Kiok. He has been a partner of Spruce for 2+ years and has partnered here at Edge for over a year. He is board certified in occupational medicine, and he is the founder of Oasis Occupational Medicine, serving the Las Vegas and Reno communities. Dr. Kiok, thank you so much for joining us. I know we can't wait to hear from you as you bring a wealth of expertise in workplace health, in injury prevention, and medical legal consulting. Next, we are joined by Dr. Harpreet Tsui, who has been a partner of Spruce for 3+ years and is a rather recent customer of Edge that we're super thrilled to be joining the family. She is a board certified internist dedicating to help people live their healthiest lives. She has completed her undergraduate studies at the University of Central Florida and attended medical school at Touro University in Northern California. She specializes in training in medical weight management. Dr. Tsui, thank you again so much for joining us today. Jessica, I know you're excited to start this fireside chat, so I'll hand over to you.
Yeah, and thank you both for being customers with Spruce for a little bit now. And I think today is really going to be about just sharing how you've made your practice more efficient with both Edge and Spruce. And so first, we just wanted to kind of go back to the before image. You guys both, I believe, both started new practices and had some stuff in place before. And so tell me a little bit about, what was your practice like before Spruce and before Edge? And what was going on that wasn't really working that you seek the solution?
Guess I'll jump in first if that's all right.
Great. Yeah.
So thank you all for the intro. That's never heard myself described so expertly before. That's pretty cool.
We're here for it.
So my practice is barely 2 years old, and they say private practice is going extinct. It's hard to do. Blah blah blah. And of course it is, right? It's hard to do if you don't think forward. I graduated residency in 21, and I worked a corporate job for a single year where I saw certain things done very well and certain things done not very well. And in starting the practice in 22, it's my chance to take some ownership of the processes that I didn't like. So Spruce was there from the very get-go, right? One thing I really disliked about the places I worked was the lack of accountability that would occur sometimes with communication. So, I called them, they called me. No one knows when the phone rang, if it rang, what happened, who talked to whom, right? It's 2025, y'all, right? There's no reason for this kind of problem to exist. And Spruce was pretty much an obvious choice from the get-go to address the accountability problem, with the added bonus of being available on a mobile app, right? So I'm running around all over the place. I can check the messages. I can bug my folks to do stuff, take calls on my own, and communicate within my own office. That's my Spruce story. I'd like to give maybe Dr. Tsui a chance to chime in here.
Yeah, thanks. So thank you again for having me. I actually have had this practice for 2.5 years, and I was with another platform when I had first joined. So after 11 years of being an employed physician, I decided to open up my direct primary care, and I had joined with another platform. But the problem with that platform was that I was getting messages coming in with my regular phone calls, and I couldn't always differentiate who was a patient and who was not a patient. And so I had gone to the DPC Summit in Kansas City in the summer of 2022 and had learned about Spruce there. And I was immediately hooked. I loved the platform. I loved the fact that it was a separate app. I love that I too can also assign tasks to my medical assistant, who obviously is from Edge, and we can really collaborate together. And I know that the patient messages are coming from one side and they're not getting bogged down with the rest of my messages. I'm a working mom. My husband's in medicine as well. So our schedules are very busy. So I need to be able to separate both of them. And Spruce it's changed my life, really. Well, if I can say that. Can I say that? It's changed the way I communicate.
Of course you can say that. It's changed my life too. I've been here 8 years. So did you both start with the Spruce phone system before you even, or were you using like a cell phone before or a landline? What was your phone system prior to Spruce? Go ahead,
So
either of you.
for me, I started with Spruce from the get-go, but
Yeah.
Spruce, I guess, enabled me to invite too much work onto myself. So I answered my own phone for an entire year.
Yeah.
Starting when I started the practice. Okay, I will hopefully never do that again, but it was quite humbling. And it was part of that experience that led me to Edge, right? I kind of forgot to mention how Edge showed up in my life.
Yeah.
After a year of answering my own phone, I kind of lost my mind a little bit and realized it's time to grow up and delegate. And that's where Edge came in to solve the back office problems. But to answer your question, I started from the beginning with Spruce.
Great. Yeah. So let's go more into your staffing. Like, what was it? Did you guys just start? A lot of practices, what you're talking about resonated a lot, and that we're seeing a lot of people leave kind of the big hospital systems, start their own practice, which is hard. And you're like, I don't know what to do. I have to hire people. Like what? And so what did you start just by yourself, or did you hire some people? Did you go remote immediately? Tell us a little bit about that story.
I chose not to hire anybody off the bat. I was a true micro practice, literally just me, and a lot like Dr. Kiok, answering my own phone calls. One thing I love about Spruce is the texting capability. So I tell a lot of my patients, even my older patient population, like, we're going to learn how to text because that's the only way you're going to get a hold of me when I'm seeing patients. So I did not hire anybody until probably 18 months in. And I did start off with a different virtual healthcare company, and Spruce before, I'm relatively new to Edge, but I was kind of doing everything myself until it got to the point where I really needed to hire someone. I'm down in Las Vegas, and just it's hard to find good help, and it was just really like, if I could keep the practice small and just give the patients the personalized care that they need and just answer the phone, I'll do it until I can't do it anymore.
Right.
Yeah. And thank you both for sharing. One of the main reasons that Edge reached out to Spruce in the first place is every time we called a medical practice who was interested in adding on remote employees, the constant thing we heard was that Spruce was a no-brainer for us, right? And that obviously gave us a lot of confidence in reaching out to Jessica and team. But curious, Dr. Kiok, I know you mentioned you've been with Spruce from the start. Dr. Tsui, a little bit of a different experience. What type of issues or pains, challenges did you run into that ultimately made you settle at Spruce and say this is the right partner to move forward with?
So like Dr. Tsui, I wanted to pay more attention to kind of what was going on in my office and do everything myself for a while. I actually didn't hire anyone for about a full year. So not 18 months, but still 12 long, painful months without any help. And wait, I'm sorry, I forgot the question.
No, you're totally okay. I understand with your experience. You were handling phone calls yourself for your first year, right? And that's super commendable, yet challenging. The question was more geared towards like, what other pain points did either of you run into when it came to ultimately settling and really wanting to find that right type of partner in Spruce?
Sure. So a traditional phone system requires someone physically there to answer the call. And so in an era where, the internet is widely available, content streams instantly, this seemed kind of inexcusable, really, to operate a practice in a manner that was so prone to, I guess, a single point of failure, right? If someone's butt is not in the chair, the phone cannot be answered. Right. Just doesn't work for me. So.
Yeah.
For me, I think the biggest thing is initially I was in a system where the electronic health records and the phone system and the fax system were tied into one all together. And I tried that for a few months. And so I was losing faxes and I was not getting phone calls. And the thing that I love the most about Spruce, besides the app, is the fact that everything filters in, right? So I've got my folders, I've got my appointments, I've got billing, I've got refills, I've got new patients, I've got my little folders on the side. We never miss a call, we never miss a text. And so those pain points that I was having initially with the system I was in, Spruce really took care of that. And I will say also, I had issues in the beginning just setting up phone trees, and Spruce was so great. Like I probably called them 5 times in one day. And they were just so great. Like, okay, send us an email. We'll walk you through. Let us help you. And that's really like, as a direct primary care provider, that's what I do for my patients. And I expect the companies that I work with to give me that same level of service. And Spruce really did that and stepped up. And so it was pretty easy to stay with them.
Yeah, that's incredible. And Dr. Tsui, you had a point earlier where you mentioned, you're in the Vegas region, and it can be difficult to find talent that makes sense in your practice locally, right? I'd love to explore that a little bit. And I also understand that there was prior to Edge, there was another organization that you had worked with. What type of hesitations did you have going into that first experience with remote work?
You get really nervous because I'm so used to having a medical assistant down the hall or right there. So it's just turning around and saying, hey, patient X needs this X, Y, and Z done, right? And getting it done. And I had gotten to the point where I was very overwhelmed and I had to really look out for a virtual assistant. And unfortunately, like I said, the first company I was with, it just didn't work well for me because what I needed was a company that, again, could meet me at the level of care that I provide for my patients. So the things that I think a lot of doctors get nervous about is, well, how does it work if they're international? How are we paying them? What are they responsible for? There's a lot of questions I've gotten in regards to HIPAA compliance, for virtual assistants, and what can they actually do? That is the biggest question.
Yeah.
What are you tasking them to do? And so I feel like using Edge, I've been able to get everything I wanted, but my medical assistant does everything an in-person medical assistant would do.
So why don't we back up a second and let's just talk about what you have set up as a remote team, a remote talent today. Like what do you have set up? What is their title? Like, are they an MA? Are they a front desk? Are they all the things? Tell us a little bit more details about like what you move to remote work.
Mine, I call her my medical assistant. We're a
Okay.
team together. So she does front desk, back end, every call, referrals, prior authorizations, prescriptions, getting records. I mean, she's doing everything a person in the office would be doing front end and back end.
So when your phone rings, do they answer it?
Yes. When my phone rings, she gets it.
And where are they and this might be for you. Like where are they located? Or how are they answered? Like do they make calls from your same phone number? Like let's get into the details because it sounds like those are some of the questions people had like about how, having someone virtual works.
Okay,
Yeah.
so let me just pop in and tell you why Edge was so great for me. So I have a Google Voice number, and that's the number that we use for Spruce for my medical assistant. But what was so great about Edge, and I'm sure Dr. Kiok will say the same thing, is they trained my MA on the EHR I use, on exactly how to use Spruce, on the protocols. And so when she came in to my life and I set out, these are the day-to-day things that we need to get accomplished, she was able to just slip in like she's worked for me for weeks and like that she understood Spruce like better than I did by the time she was done with training.
Love it.
Yeah. That's incredible to hear. And one thing you had mentioned a little bit earlier, Dr. Shui, is that some of the hesitations you had, right, while considering remote work. And I think it's very fair to assume, Jessica, that security is the number one issue and hesitation that most physicians, most practice office managers, right, are thinking through when bringing on a remote employee. To your earlier question, where are these individuals located? I think with Edge specifically, not to harp too much on this, but we've identified that even needing bilingual Spanish speakers has become so hard to find, right? So Central America is one region, and then Southeast Asia is another region where we found a ton of success. But really, regardless of location, I think what's more important is understanding when we met with Dr. Kiok, when we met with Dr. Tsui, what makes someone the right fit for your practice, right? Similar to Spruce coming in and being that ideal fit, if you are bringing on an employee, how do they really be the ideal perfect scenario? And I think that's what's allowed us to stand out, and hopefully spoken to some of your concerns, Dr. Tsui.
Yes, for sure. Dr. Kiok, what do you think?
Hey, so I don't know if I mentioned this at the beginning, but I'm also in Vegas, so I didn't know we're both here in Vegas.
Oh, wow.
Pretty cool. And to your point, right? Hard to hire in Vegas. I had the same problem. Before I brought Edge into my office, I had actually gone off a couple of recommendations for in-person candidates who did the exact things that every other practice owner warned me about. They flaked, something happened, and they weren't able to show up and actually get the job done. In my particular use case, because I envisioned Oasis as a tech-forward kind of place, right? From the get-go, it was me and my sister who founded it. My sister does billing remotely from Louisiana, so I already needed a platform to communicate efficiently with people who are not located in Vegas. That's where Spruce came in. Where Edge came in is because I have a lot of Spanish-speaking patients in my office, and these patients don't deserve listening to my 3 months at UNLV medical Spanish, right? They deserve better. So I approached Edge with this scenario. I said, hey, listen, I've had a couple in-person folks flake out, and I'm willing to sort of redesign some of my workflows and to think outside the box a little bit if it'll get me someone who can deliver what I need. And what do you know? They found a candidate who used to work as an interpreter and speaks 4 languages, right? English, German, French, Spanish, all fluently. I mean, where are you going to find this kind of person in Vegas?
I don't know.
Right? So that's been my experience kind of synergizing Edge and Spruce so far. And obviously, if someone is working remotely from South America, the phone system, the communication platform needs to be as agile as the rest of the office in order to facilitate efficient communication. And I think it works pretty well.
Yeah, thank you for sharing both. One piece of from a medical practice perspective we've seen is not only, of course, is there hesitation when hiring anyone, right? Whether they're locally, whether they're based remotely, but also adapting to new technology and how the patients will respond to that. I'm curious to hear on both ends, from the Spruce technology piece to the actual remote employee that has joined the family of both of your practice. How has the patient reaction been to that?
Everyone wants to meet. His name's Diego, right? So Diego works from my office. He's very nice, right? I guess people aren't used to being greeted by someone nice on the phone. That's how low the bar is, it seems like.
So sad.
Right? So of course they're always disappointed when they come to the office and it's just me. So that's the problem.
That's a good problem to have.
Everybody wants to meet Miriam. During the holidays, people were like, I baked Miriam a cake. And I'm like, she is not here at the moment, but thank you so much for the thought and kindness. Because again, they're not used to somebody picking up the phone, right? How many times have patients told both of us, oh, I call so-and-so doctor's office and I just have to leave a message. I've left a message every day for 7 days and no one's called me back. So I think they're just shocked at the idea that our Edge employees are answering texts and answering the phones.
Right. I have a follow-up question from the audience. And so someone asked, because you mentioned that they train them on the technology. So did you send Edge a list of the platforms you use and what skill sets you were looking for? And then kind of on top of that, what percentage would you say Edge was involved in the hiring process and you were involved in the hiring process? Anybody can answer this.
Okay, so for me, because I'm so new to Edge, I did send them a list of what I was using, right? My EHR, Spruce, email, all of that kind of stuff, so that my MA could be trained on that beforehand. We were 100% involved in the hiring process. As an aside, my husband's practice also uses Edge, and I actually sat in all those interviews too. And so we were 100% involved. We had, for me, we interviewed 3 candidates. For my husband, we interviewed 4 and re-interviewed 2. So there was never a time where Edge was like, nope, sorry, can't get somebody else. They literally said, we will interview as many people as we need until you get the right person.
Edge was quite involved in my hiring process as well. In fact, I would say in hindsight, they handed it to me on a silver platter. You know, I'm in a position now where I've grown to the point where I can hire an in-person employee to do in-person things only, such as phlebotomy, right? There's no virtual phlebotomist yet. But this process is wearing me down. In hindsight, Ez just presented a list of about 5 or 6 really well-qualified candidates. I interviewed all of them. And basically, Diego was a no-brainer. He fit exactly the description I was looking for, including some of the proficiencies in the platforms. Although I was very hands-on in training on the platforms too, just because I was a new practice. You know, I'm still learning how to optimize the usage and delegate work.
Yeah, I have a follow-up. Oh, go ahead. Go ahead. Oh, so it sounds like each of you guys have 1 employee. Is that right? That's 100%. So no in-person employees.
Not yet.
Not yet. Because one of the questions that just came up, and Ahmed, maybe you can answer this for some of your clients that do have both in-person employees and remote. Virtual MA. How do they do vaccines? How do they check out a patient? So so my first question based on that question is, you know, do you have some that have hybrid, that will have some in person and some remote? And then the next follow-up is, for those of you guys that don't have someone in person, are you just doing that because you're still small enough that you can do the actual check-in, check-out process?
Yes. So of course, you know, there are limitations to remote work. I just, you know, gave the example of phlebotomy, right? There's no virtual phlebotomist. There's no virtual vital signs, you know, not really, but the business model of this solo practice of mine is to be a place of low volume and high attention. And so I don't mind doing vitals. I don't mind spending this extra time with the patients, right? Because my business model doesn't require this stuff to be delegated to someone and for me to truck through 30, 40 patients a day. I can afford to take my time with everybody. Right. And something as simple as the vitals is a great way to build that relationship. To your other question about hybrid, the person I'm looking at for an in-person role now is actually, they don't want hybrid. They want 100% in person. Go figure. So it seems like I got lucky. And these 2 folks, one from Edge and one from Las Vegas, will end up in a very synergistic complementary role.
Yeah, thank you for asking, for answering that question, Dr. Kiok. You know, I would say majority of our customer partners today, dependent on size, right, or of course either having just remote staff through Edge and themselves as care providers, right, or they do definitely have in-person medical assistants who are taking care of patient-facing roles, right. What we've typically heard for any of those practices that have kind of a hybrid model with remote work and in-person staff is the in-person staff have been suffering from being able to not only be patient-facing but also answer phone calls, doing prior authorizations, insurance verification, et cetera, all of that admin work. And that's, a prior auth for certain practices can take, up to 30 minutes to an hour each, right? And so naturally, it's not necessarily the most efficient use of time to have in-person people doing that. So in that scenario, they've split it out, right? Where phone call management, right, being patient-facing, but from a remote perspective, and then being able to handle any of the intake process along with scheduling and any of the back office tasks are what a remote employee would do, while the in-person staff focuses on receiving the vitals, checking patients in or out, and going from there.
Yeah, piggyback on. Oh, go ahead.
Oh, no, I think you said it best, right? There's COVID forced everyone to sort of reckon with how feasible or not feasible remote work is. I know there's a very prominent bank CEO who was leaked on a tirade about remote work recently. I'm not going to name him because he can probably buy me out and sue me into oblivion if I talk smack. But being a business owner allows you to take full ownership of everything that goes on in your practice. And part of that is thinking outside the box. And so If there is no reason for an in-person employee to sit there on the phone, harping on with the insurance company, and this can be delegated out, this will allow the people who are in person to be more efficient and to do the tasks that only someone in person can do. So I think of this as just being smarter, right? Structuring your practice a little bit smarter and not doing it the way everyone else did just because of the way they do it. Because like Dr. Tsui said, everyone's expectation of a doctor's office is this mismanaged, hostile place where no one answers the phone, the doctor's an hour late. That's not the place I want to be. Dr. Tsui, do you have any thoughts you want to add in on that?
I kind of want to give an example because I'm watching the Q&A at the same time. And so as a direct primary care doctor, we don't take insurance, but my MA can answer any question from anyone that calls. So I have my Spruce set up for new patients where if they call and we miss the call, there's an auto reply. Do you have any questions? Then they text in their questions and then we answer it. One thing that I think makes it easy, and one thing that I think that we forget when we check patients out in primary care practices, I don't do vaccines, so I can't talk about that. But one thing that we are so used to doing is having our MA like write the lab slip, write the referral, like having the in-office person write the stuff and give it to the patient. In my practice, every patient knows you will get an email or it'll come through Spruce as a file through the HIPAA compliant app, and everything you need will be there. So then that's a task that my MA from Edge can do. She'll do the referrals. She'll do any imaging orders, any lab orders that we can't do in the office. And that way it's like she's in the office, but the patient literally comes in, I room them, I vital them, I do what I need to do, and then they leave. And it's takes away that need for somebody in the practice doing that kind of mundane paperwork, right? And so it makes it easier. I think the patients leave happier because they're like, oh, I don't need a copay or I don't need to fill anything out. And I'm like, no, just go. We'll take care of it. We'll email you later.
Jessica, I believe you're on mute.
Yep. So it does sound like they can do what you need, insurance, whatnot. And how do you communicate to your virtual staff or your remote staff?
We communicate fully through Spruce. So we have a team chat. We check in every day. We page each other through Spruce. We have a Zoom meeting. We try to do it once a week, either at the beginning of the week or the end of the week to make sure that we accomplish everything. But our day-to-day, we only speak via Spruce.
And Ahmed, for companies that are not using Spruce, are they just setting up kind of random different things like email or chat, some other random solution?
Yeah, 100%. I would say, your most typical are like Microsoft Teams, Google Chat.
Got it.
Zoom if they have that video component, but if not, you have direct access to cell phone numbers as well, so you can always send an email, text, call. That works as well.
All right, another quick question about Edge. What is it, full-time only, or can you do part-time? What's the requirement for employees?
Yeah, this was a kind of interesting piece because I think when we are constructing Edge and looking at what will make it most impactful for practice owners in the future, we found that there are a lot of companies that exist, right? I think virtual assistant companies that offer part-time, but the issue with that becomes you don't necessarily have dedicated staff members to your practice, right? You may have one today while another is there tomorrow, we found that to not necessarily be the most desired outcome for most dental or for most medical practices. And so at this time, we only do offer full-time individuals, so we can match one-to-one, to our practice customers, but then also give them the best potential, for the employee experience that, but also for our client experience that as well. So only full-time at this point.
Great. Also, just got a random question. I just want to clarify because we're kind of midway through. So we are recording this call, so you will be able to watch it if you have to cut out. And someone asked just kind of what's Edge versus Spruce. So Spruce is a communications platform, and we partnered with Edge for this webinar only, and we are working together because we have multiple customers that use both solutions. And Edge is a remote staffing company. So they have remote talent that they can help virtually fill as employees into your office. And so we brought them in because a lot of people, I've worked at Spruce for 8 years. the increase in the amount of remote workers for our practices it's like tenfold increase in the last couple of years. And so we constantly get questions about this. So we wanted to bring them in as experts in remote hiring, and for you an opportunity to ask any questions about how it works. Like, can I hire full-time or part-time? So we are separate companies, but we just like what they're doing, and they're helping, practices operate more efficiently, which is a goal of ours. So that was my question. Any other questions you guys saw in there or you wanted to bring up?
Yeah, Jessica, I think similar to the prior question, which is for any of those practices that are open, let's say 2 or 3 days a week rather than full time.
Yep.
Just eliminate me from using Edge. And the direct answer is no. I mean, we have a ton of practices that are open 2 to 4 days that do have a ton of admin work that still want phone calls to be answered because they are in a landscape. So Edge employees are able to still work Monday through Friday in a full-time capacity for those practices. But if you are simply looking for someone to only operate while you are in operation Monday, Tuesday, and Wednesday, then yes, we do offer kind of a full-time service only.
Can I jump in on the tail end of that, Ahmed? So I initially, when I started the whole virtual assistant journey, I did have a part-time employee who only answered while we were there. But I will say, even though my patient population is still small, having a full-time employee is really great. I'm only in the office Monday through Wednesday. Thursday and Friday, I'm not in. And Friday, our office is closed. But Miriam's answering calls. We're catching up on stuff. We're getting records. Like, we are busy the 2 days that we're not in the office. So sometimes I think as doctors, because we've never done the back end stuff, we've only ever done the patient facing stuff, that we don't necessarily realize what an MA can do and what having staff like that can really, how it could benefit us. And so just for anyone who's open only part-time, realize that having a full-time employee is actually quite beneficial, because then, like, case in point, I have a meeting on Friday. I don't have to worry about my phone calls not being answered and our stuff being done, because she'll be online while I'm in a meeting.
Yeah. And one thing I coach a lot of practices on is sales. So you have people calling your practice interested in your business. Are you documenting this? Are you calling them back? Do you have a script for your person answering your call, educating them about your insurance policies, your schedule, what services, and what occupational med, like what you specifically can help with, what you can't help with, referrals. So all of that can be done by this virtual employee as well, can be documented really easily, and so you can follow up when you're back in the office on Monday. So it can be assigned to you. And someone had a follow-up question about how do I call my virtual assistant in a foreign country, frankly. And so in Spruce, so they all are assigned their own number. It's a 10-digit US-based number that forwards to their computer to answer live, or to a third-party system, or their cell phone in that international area. So you can make calls to their direct number, or I would guess, and you could probably nod in agreement or disagree with me, but a lot less is done over the phone. And it's now over messaging, and you say, hey, Jessica, can you do this? Or the voicemail's right up there, transcribed, and you say, hey, can you respond to this and do this or that? So I think you can reduce the amount of phone calls when you're using a good HIPAA compliant source as well, but you can call each other. And we have, the group chat as well in Spruce, but you could definitely call as well. And at some point soon, Spruce will be offering better team video to video calling. So that will be something that will help with that. We don't have that today. So if you're looking for it, we don't have it. So you can only video call your patients. You can't video call your teammates today. All right, oh yeah, go ahead.
So I'll jump in. I see there's a couple questions regarding Edge and the setup, right? And
please.
One of the questions, or a few of the questions actually, are regarding specific tasks, right? Can my remote employee handle payments, set follow-up appointments in real time? like a in-person receptionist would, can they handle insurance verification? So the answer to all of these is yes. The easiest way to really process this, what Edge is that it is your full-time employee, right? So day-to-day management of this employee will be your responsibility, and ultimately you're able to shape their job description, their responsibilities as you wish. So when we originally spoke with, Dr. Kiok, when we spoke with Dr. Tsui, we built a job description with their help, right? Identified what the ideal candidate would look like. And once they actually go through the training and start with both of those practices, now the day-to-day management is your responsibility. So to all of those questions, yes, we are definitely able to help. If the task can be done in a remote manner, then consider it a part of the responsibility list. There were some questions regarding, cost of remote employees and what that looks like. And so while we don't necessarily need to get into the specifics, what we are finding today is that practices, dependent on where they're at in the United States, are able to conservatively save about 30 to 60% on staffing costs, HR policies. On paper, this is an Edge employee, so we take care of the legal logistics, the salary, the benefits, etc. But the day-to-day management is as if it is your direct employee. And of course, if you'd like to learn more there, feel free to go to onedge.co and request some time to connect, and we can definitely walk you through.
Awesome. Thanks, Ryan. And again, we're going to do this at the end, but what is the email address that they can email right now, or the website that they can go to right now if they want to kind of explore?
Yeah, absolutely. That is www.on, so onedge.co, and the website or the email address to request more information that way is sales@onedge.co. I believe our last slide will represent that email and website for you if anyone wants to note that down.
All right. And someone just asked that, is who pays them? Do they get paid directly through Edge, or do they get paid through the practice?
Yeah, great question. So we, Edge specifically, will pay them that salary. One area that we kind of looked at back in 2023 was, how do we identify top quality per the countries we serve, right? And how do we get those candidates to our partners? And so Edge did make an initiative to start paying in that 95th percentile per the regions we serve. That hand in hand has given us access to your top 1, 2, 3% of graduating talent. We directly pay them, and then we have a agreement with our Edge partners and customers where they would pay us. So we take care of all of those logistics.
Great. Also, someone just asked what country. So where are your remote staff? What countries?
Yeah, for sure. So the individuals are not located in the US. I saw that question come up as well. They are located internationally, Central America for any practices that require Spanish speakers, and on the Southeast Asian side for anyone who is just looking for a English-speaking individual. They are HIPAA certified, of course. We are HIPAA certified as an organization located here in California, and they do at minimum have a bachelor's degree as well.
Awesome. So someone was asking they wanted help with using a virtual employee for like scripts and what to say for auto replies to make the practice more efficient. Is that something that you will work on with the practitioner? Ahmed?
Yeah, absolutely. I mean, I think we're able to kind of fit the customization as needed, right? Even I think there was a question earlier, Jessica, regarding like, how does an Edge employee or a remote employee get trained on Spruce, right? And so again, with Dr. Kiok, Dr. Tsui, sharing this information with us in the onboarding process, we're able to get them trained. And then once they actually start, we all know that typically using the system for a limited amount of time will get them pretty caught up to speed quickly. Dr. Kiok, Dr. Tsui, anything you would add there in regards to your experience with that specifically?
I think it's very similar to just training a real life medical assistant. I see a lot of questions about like, can you certify them in coding and how do you teach them how to bill? And that's our responsibility as the physicians, just as it would be our responsibility to teach an in-person biller, coder, medical assistant, front desk, back desk to do all of that. And I'm a big proponent of Loom videos and Google Docs and spreadsheets and, any question that my MA ever has about anything, we will sit down and walk through it just like we would if she was sitting in my office.
I'd probably like to echo what Dr. Tsui said. Very hands-on with my practice. And Jessica brought up a good point earlier about sales when people call the office. This was not an angle that I had thought about much when I was delegating the phone off finally to someone besides me, because I used to handle the sales calls myself. But I was very involved in training my own Edge employee in the nuances of my practice, just because no one knows it better than you. And if you're the practice owner, it's up to you to dictate the kind of culture and expectations that you have for your environment or how you want certain platforms to be used. So, for example, I don't necessarily call my Edge employee through Spruce exclusively. I have a Google Workspace account that I use for on-demand videoing, especially when I need a live in-person or live interpretation. So for generic things such as email, how to use this technology platform, Edge was able to provide the starting point for my employee. But then in training the workflows that are specific for my practice or what my expectations are regarding when to page me and when to not bug me or when to delegate it off to my billing side, that was all me. If it's not you, I don't know who else it's going to be.
True. Any for the physicians, is there any tips that make working with your virtual employee or remote talent that you've been like, oh, makes it so much easier. I've done this. I've changed like this workflow.
I think what I really liked about Spruce from the get-go was the ability to document on the phone calls or patient interactions, in contrast to, let's say, a traditional office that only has a telephone. Because this way I can set a culture of accountability with every single patient interaction, and that anyone who's working in my office, whether in person, part-time, remote, etc., can pick up on a task that was done by someone else and understand what happened. So if someone else answers the phone next time, or I have to cover, or etc., we understand that X patient called about a refill and is having trouble with the pharmacy. It sounds simple, but I think this little synergy here has made one of the biggest differences in how my practice is perceived on the patient experience side. Dr. Tsui?
I agree 100%. And I think it's giving that personalized, sounds like both you and I have very like personalized practices, right? So it's really giving patients that, I call it old-timey medicine, right? Like when we were young and we used to get sick and like our parents would call our family doctor and they'd be like, oh, hey, Sue, like I need to see Harpreet. Like it was easy. I want to give them that. My MA does that. And again, with the Spruce side of it, because everything is tracked, I love that you can sync the messages. You got the note there. You can do what needs to be done. And it's very seamless. Spruce has made my job extremely seamless. And as questions come up from my VA, we're tackling them right then and there. And she also knows, when to ping me, when not to ping me, what she can handle on her own and what she can't. But anytime she's stuck, we just, internal notes, hey, how do I do this? Okay, hold on, let me walk you through it. And so it's just that real-time action, just kind of like if you had somebody in your office. Spruce just makes it really easy.
Yeah, and I think it's just important to have somewhere that's documentation's online and secure. Obviously I want everyone to use Spruce, but everyone doesn't. And you can still use virtual talent, but you do have to now think of these things. Like, where are the voicemails stored? Are they on a physical desk phone? Are they being emailed, which is not secure? So you just have to make sure you have a secure connection to each other. And yes, Spruce makes this easier. And that's, I think, why a lot of virtual assistant companies like using Spruce with their practices. But just having it so you don't have to have duplicate documentation. Everything in Spruce is auto documented. And so it makes it really easy. We have a few more questions in there. We have 10 more minutes, but we have a lot of questions. I think some people had some follow-up questions about the billers. So do you, Ahmad, this is for you. Do you guys have specific roles? Like, you have this person is going to be more focused on front desk answering. They're going to be chipper and excited. And then you have someone that's more like heads down. I'm going to be doing the billing. Do you have certain roles, or do you train for as you go?
Yeah, really, really strong question, Jessica, and of course whoever asked that in the chat. It's interesting because we've had a lot of physicians come to us and say we're looking for A to Z help, right? We want
Right.
some front office, back office, and we're like, hold on, let's make sure the individual is strong in one, two, or three areas before we expand it to everything, right? Or potentially bring on more than one individual. We have a group. It's a larger group. It's called DHR Health. They're based out of McAllen, Texas. And they have 80 plus individuals live across 6 or 7 different roles. So to answer that question directly, yes, we definitely push towards having a dedicated role. If the practice is large enough, and there is room for multiple, then typically someone as an insurance coordinator or a billing coordinator can directly help with billing. While we are not a billing organization, any of the follow-up required to that, right? Any of the claims follow-up, the patient side, the posting payment side, we're able to do that. We've been working with a handful of clients kind of on the down low to actually build out AI towards billing, right? And more to come on that. But a different dedicated role, if you're looking at someone for the front office, would actually be answering incoming patient phone calls, being able to schedule patients. One big piece also is referral and recall management, right? So yes, dedicated roles, we always will push towards that, unless a practice is significantly smaller where they're able to help in different regards.
Awesome. All right. So you touched on this briefly. Working with someone internationally, always you have security concerns. So are there certain guidelines that Edge does to certify this? Obviously, any communication that happens in Spruce is secure and encrypted, even if you're outside the US. But what's kind of the certification your staff go through?
Yeah, exactly. So HIPAA compliancy is a must. As an organization, I mentioned we are HIPAA compliant. All equipment is provided through Edge. So, computer, monitor, headset, access to the voice over IP, internet. Patient health information, let's say through the EMR, can only be accessed through that equipment. We also do provide, VPNs to ensure that all information is encrypted and shows US IPs. We are a company, Jessica, that was built on security, right? And so, we are physician backed from our founding team, and for him it was incredibly important to ensure that this company does not actually start until we have these security protocols in place. So something as big as SOC 2 certification, the highest level of cyber security clearance, is something we carry. So by all means, we want to ensure that any of the clients that we're partnering with, we're giving them ease of use, right, and bringing in a remote employee and not adding on one more hesitation.
Fantastic. All right. So we went over a lot of different things, and we have 7 more minutes. We have a few more questions. Some of them are more specifically about Spruce, so I'm leaving those to the very, very end. And any others? Oh, someone asked about, so if someone calls in and has a refill request or a medication question, are you having your staff take a message? Are they transferring the call to you? Are they message you? How do you handle things that they need help on? And this for anyone.
Yeah, so the benefit of Spruce is that you can do the traditional, let's say, warm handoff or warm transfer if it's something that needs to be connected to me right now. In my practice, there's basically no such thing that really needs to be connected to me right now. Everything can wait. And so I'll have my assistant from Edge take a message, right? Take a message, and I'll deal with it myself, whether it's a response through texting through Spruce, or if I have to e-prescribe through my EMR. Yeah, pretty straightforward.
I do mine a little bit differently. So primary care practice, so a lot of my patients we've had for a long time. So if it's a medication a patient has been on for a long time, my MA knows she can go ahead and refill it, because again, I follow the conversation in Spruce. I also am, I will check every single message on every single patient that came through at the end of the day to make sure that we got everything. So I give her that ability to go ahead and refill a prescription. And if she has a question, she'll just tag me in the conversation. And if I need to reach out to the patient, I usually will just text them to clarify.
Fantastic. All right. So any other key takeaways that you have, any hesitations before you decided to move forward with remote workers and remote talent, anything like that you would say to your past self, essentially, to move faster into this?
I think I would say I would have gone with Edge sooner. Like I should have gone with the company that supports their providers. There are companies out there that don't. And Edge, from the very first meeting I had up until today, I've never had an issue. If I have a finance question, they will get me to someone. If I have or EHR is down, they'll get me to someone. It's really nice to be supported by a company that values not just your practice, but values you as a client.
I brought on Edge basically as fast as reasonably possible, right? I think my practice is in uncharted territory in so many ways. You know, there's no solo occupational medicine practices anymore. My hesitation in the beginning was maybe how the patients would perceive having a remote worker address their concerns, or if they would get weirded out or anything like that. I'm happy to say not only have they not to raise any objections about it, they're actually have the opposite. They are so pleasantly surprised to be greeted by someone nice on the phone. They just forget or don't care that they're remote, and they're bummed that they only get to see me. That's really it.
Well, I'm sure that's not true. I'm sure you're providing some good healthcare, but I understand what you're saying. And all right, let me go to the next slide here. And also everybody attending who's made it through the 57 minutes, thank you. And please put in your last minute questions. We have a few more minutes. And we are available. We're going to send you this information, the recording, the slide deck, and our contact information if you have additional questions. There was some Spruce questions that were specific about how do I set up auto replies? I want one number to go to multiple people. Love them. So please message or email sales@sprucehealth.com, and also message into your team Spruce if you're a current customer, and they're happy to help. Also, you know, we have weekly onboarding webinars specific to Spruce. And those are for if you're signing up for Spruce or you're moving, you need to set up a phone tree. You can attend those. They're going to actually be a live Zoom where you can verbally ask questions, not a Q&A. So that's a great resource for everyone on the call if you are a Spruce user and you want to optimize your plan. I mean, what you're using in Spruce. But all right, we have one more. Okay, so someone also asked about how much does it cost for the employees through Edge? I would highly recommend emailing sales@oneedge.co, and they will help you kind of give you some quotes on what's going to be for your practice. But it sounded like they are, anything else you want to add there, Ahmed?
Yeah. You know, the tail end of that question, and I think one that we think about often is, are we able to pay individuals, you know, fair wages, right, and give them, you know, fair and democratic access to roles that they wouldn't have? And so that answer is yes. You know, I mentioned earlier we do pay in the 95th percentile per the country standard, so they are being, you know, paid very well, and ultimately that's what leads to 90% plus retention year over year. But you know, as Jessica mentioned, in order to learn some more information and send everyone home today after this you know, lengthy hour and great hour of conversation, feel free to, you know, visit both of our websites or email in, and we're able to set up some time. Dr. Kiok, Dr. Tsui, Jessica, this was an amazing conversation, and Dr. Kiok and Dr. Tsui specifically, we appreciate you taking the time to join us today and speak on both of your experiences. Ideally, for Jessica and myself, there are more and more practices that are using both technologies, and we look forward to those conversations. Thank you again.
Thank you so much for having us.
Yes, a pleasure to speak with you guys.
Thanks everyone for joining, and good luck in your growing practice, you two. And thank you so much for attending, and same with you, Ahmed. Looking forward to working with everybody more. Bye everyone. Have a good rest of the week.